6 months before we did a pretty extensive rebrand exercise, somebody sent me a post of an alumni who had a very large tattoo of the Plymouth House logo. I believe it was on their calf. Um, and that was a real discussion point on, do we want to mess with that level of brand loyalty and commitment as we go through this process? Then it really was a discussion point, is like, how do we deal with, messing with a location and a brand and a name and a logo that somebody attributes to saving their lives.
Tell us a little bit about Guardian, how long it's been around, who you serve, the locations, all of that stuff. Give us kind of the backstory of where you're at right now, at least.
I'm the chief strategy officer at Guardian. I've been with the organization close to a decade. Um, I started as marketing director, which was a focus primarily on digital. Throughout the years, it's gone from marketing director to VP of marketing to now chief strategy officer. We we're at 20, I think coming up on 21 locations across the country. We are in 6, soon to be 7 states. So we're in Florida, New Jersey, Maine, New Hampshire, Texas, Colorado, and coming soon here to Wisconsin and Kenosha in the near future. We started off as primary adult substance use disorder treatment, but as we've expanded, we've really turned into a behavioral health care platform. So we do mental health treatment for adults and adolescents. We have a unique purpose-built adolescent program in New Jersey too that only does adolescent treatment, inpatient, residential. We are all outpatient mental health now, but in the near future, we're going to be opening our first inpatient mental health residential location as well. So yeah, I mean, at this point, we haven't gotten into any of the like really niche, like gambling addiction or sex addiction or eating disorder. Like, we haven't done any of those specializations yet, but just general adult substance use disorder treatment, mental health treatment, adolescent treatment. Um, yeah, that's us. And yeah, when I started, you know, 9, 10 years ago, I was brought in because Guardian has really always done business development very, very well.
Mhm.
But because of this expansion, and to give you an idea, when I started, we were just opening, I believe, our 3rd location. So we were just in Florida, we had Maine, and we were just opening our first location in Jersey. So
Mhm.
in 8 or 9 years, we've grown really,
Mhm.
really quickly. And they brought me in to really focus on digital because that was my background, always was. And the team knew, like, hey, we can't just ignore this area of the marketing channel if we want to grow the way we want to grow. And that's, been my focus for the last years. Recently it's shifted to just more high level organizational strategy, which I've really, really enjoyed. But yeah, that's where we're at today.
When you think about all the treatment centers out there, and when you look back at when you were just at those 3 locations, what was the thing that everybody at the organization was saying that you were trying to change? What made you different? Why would somebody go to Guardian compared to like other treatment centers?
Our founder, Josh Scott, he always says he's a product of really good treatment, right? So when he needed good treatment was there and it saved his life. So in our early days, when we were just an intervention practice in Delray Beach, Florida, doing outpatient services, we were always client first. Like, that was our North Star. If it improves the client outcomes and experience, we do it. If it doesn't, we don't. Simple. Sounds simple. As you grow, like, those questions become difficult sometimes when you're trying to, balance business growth
Mhm.
with client experience, but we've always taken the client experience and client outcome route. So when we started that, couple locations in Florida, 1 location in Jersey, we were boutique, high-end, luxury, out of network treatment, mostly private pay. And we had a really good product. Like, when, interventionists across the country were dealing with individuals who had the means to go to, exclusive, expensive treatment, they would send them to Guardian because we had a really, really great product. Like, people get sober at Guardian and they stay sober. Um, After those first couple locations, we wanted to differentiate by offering that same incredibly high level of treatment um, to a ever widening demographic. So it's easy to hire amazing clinicians and have a great program when you have a really high cost of treatment. Can we do it on a Medicaid budget? Can we do it in a network budget? And that's what we set our challenge to be. Is like we want to be able to open up programs for the masses in the areas that need it, and not discount or detract from the client experience or the clinical program or the staff expertise. And it's our challenge and mission and goal to deliver that same level of care to everybody.
Mm. Yeah, you talked a little bit about as you expand, as you have more locations, more offerings, it's challenging to make the quality also stay in line with that. Because as you mentioned, the reimbursement rates are different.
Yep.
And you want to provide the best quality care that you can, but how do you do that with those changing reimbursements? What is the way that you guys were able to keep the quality high, but still remain profitable and grow?
In order to do a Medicaid program or an in-network program and be able to maintain that quality standards, we had to do volume, right? So we couldn't, where we're used to running maybe a 20, 30, 40, 50 bed program out of network, those programs that we're opening now, Medicaid and out of net or in network programs are 70 beds, 90 beds, 100 beds, 150 beds. So we realized we could do it if we leverage the economies of scale with a bigger program. What also we've been able to leverage again with those economies of scale is as we've grown, we can centralize functions for the organization that lower the cost, right? So
Mm,
like if a program wanted to open up in one of our Medicaid markets now, and they didn't have centralized admissions that could cost share across multiple locations, they didn't have, a billing company that we owned and that can share the cost across locations. If they didn't have all those factors, it'd probably be really tough to
mm,
do. So, yeah, that's part of it is being happy with slimmer margins, but knowing that it's part of our mission to deliver this great care. Um, Being able to operate high volume facilities and like that's not an easy thing to do, and have the infrastructure on the administrative side to operate like an organization that can share cost across the organization. Yeah.
yeah. So, in order to be comfortable with the tighter margins, you really needed to make sure that you had some centralized operations, like you said, with your call center and your billing, but also that you're able to focus on doing more volume, which means you have to be better at your acquisition and the ways in which you do it. You can't rely on one way. It can't just be BD,
Mhm.
which makes sense why they brought you on to come at it from a digital perspective. And I'm guessing that trajectory wasn't linear, that there's probably some bumps in the road. And when you think about maybe the hardest season that your organization has faced, like what do you think of?
The challenge that I've laid out for you, which is like great care running very, very efficiently, that challenge becomes exponentially harder when there's rate changes. It becomes exponentially harder when there's inflation and staff cost goes up, which is by far the largest piece of our expenses. So, over the last 5 or 6 years, like inflation has affected the world at large, and our industry is no different. So,
Mm,
staff costs have gone up significantly, and reimbursement rates haven't followed the same direction. So, even though we've gotten bigger and we've gotten better and more efficient and smarter with our operations, there's external challenges that we're up against that we have to
mm,
navigate. Um, one one very hard week. Um, there was a payer in one of our markets, um, last year that decided they were going to pull out. We had an in-network contract with them. The rates were sustainable. They were 80 to 90% of our clients that were coming in had this particular payer. And they said, yep, we're leaving the marketplace. So all of our plans are going to this other payer. And that other payer's rate was less than 50% of what that first payer's rate was. So now,
You said 80 to 90%. Wow.
so imagine like our entire forecast, our entire model was built on a rate that 80% of these patients have, and now that rate is more than cut in half. So how do we operate this facility now? for literally half the amount. And this isn't again, this isn't an out of network, high end, private pay facility. This is an in network, pretty much like a Medicaid facility where every dollar needs to be very strategically spent and allocated to make the facility operate and sustain. So, those are the challenges we're up against. It's less about, you know, in especially in the Medicaid and network markets, the acquisition piece, although that is challenging. A lot of times it's how do we just even operate this thing sustainably? Even if we all of our beds were full, how do we
Yeah.
operate this thing sustainably?
What'd you do?
We had to look at the levels of care we're offering. We had to look at, you know, for example, if we're only operating detox res, right, we're capturing a small window into this person's treatment journey. Bringing another patient in the door has its own cost per acquisition, right? To tack on there. So if we didn't want to assume that cost per acquisition and we need to grow revenue, well, what do we do? So can we add on more levels of care? Can we, have that person continue on to outpatient treatment? Can we open up um, sister mental health company, because most people who are leaving addiction treatment are living with mental health diagnosis, and then offer a mental health solution for those patients as well. So how can we get more from the same patient population, and how do we look at our operations, right? Like, you know we don't want to sacrifice care, but can we do with a group size of 25 people instead of 20 people, like, and going step by step and doing that cost analysis across the
Um,
board. um, Again, our North Star, we're not taking away from the client experience. So we would rather, I think, we'd rather close down a location than give bad treatment and have people leaving harmed. But like, luckily for us, we haven't had to make that decision, and we've
mhm.
found ways to make it work. So, um, yeah, I think going back to too, what you were saying, um, in those locations where margins are slimmer, like, they don't operate on an acquisition standpoint, or an acquisition strategy the same way that an out of network location does, right? So, like, in some of my markets, I can have a double digit, you know, CPA that's sustainable. In a location where my rates are Medicaid rates and my in-network rates are getting slashed in half, like, I can't spend thousands of dollars on a cost per acquisition, on Google Ads to get someone in the door. So,
Mm,
um, that's another challenge is, okay, if we don't have the ability to, use a good percentage of the channels that we're comfortable using in other markets, how do we do patient acquisition? So it's operation efficiency. It's, can we grow lifetime value from the patients who are coming
mm,
in the care, and at the same time offer them services that are going to help them in their recovery journey? And can we rebuild our marketing channel blended mix to have it fit right with that market?
mm.
That's a long answer, but
Yeah, I mean, but it's gold, right? So it's if you're trying to be flexible in a very changing market and prices, inflation is going up, but you're not seeing the same thing happen with rates, then you have to again have centralized processes,
mhm,
right? So that you can get some cost back that way. You need to diversify the way in which you're getting folks and also figure out other ways to serve the same person because the real challenge is the acquisition and okay, once we've got somebody within our care, how do we help them longer?
mhm,
How do we help them on more parts of their journey so you don't have to continue that cycle with as much volume, but you still need volume, right? You're
mhm,
going to need more beds if you're using that and have a good business efficiency. It's like it's like when people say, "What's the best way to get in shape?" It's the things that are not complicated. It's
mhm.
hey, eat well and move your body,
Yep.
but it's hard to do, right? DJ, there's a story about somebody who went through your program and then got a tattoo of the program before you did a rebrand.
Yep.
Could you tell us that?
Yes. So 6 months before we did a pretty extensive rebrand exercise, somebody sent me a post of an alumni who had a very large tattoo of the Plymouth House logo. I believe it was on their calf. Um, and that was a real discussion point on, do we want to mess with that level of brand loyalty and commitment as we go through this process? Then it really was a discussion point, is like, how do we deal with, messing with a location and a brand and a name and a logo that somebody attributes to saving their lives? Like, that's something to be loyal about, to a brand. So that was actually a lot of the reasoning behind doing the co-brand route for a lot of those legacy locations. So, if it had a existing equity, like people had tattoos of it on their bodies, then we did a co-brand, Garden Recovery Plymouth House. If it was a newer location, maybe like outpatient, where people like, still got great treatment, but didn't
Mhm.
really feel like this strong bond, we call it, just Guardian Recovery New Brunswick Counseling Center or Hoboken Counseling Center, something like that, where we really put the Guardian brand front and center. So, but yeah, it was just, it was like uh so timely that, that I got sent that post right as we're talking about brand and how we should be thinking about this. But um yeah, it was definitely something to contend with when we went down that exercise.
Yeah, and you kept the name, but you changed the logo,
Yep.
and so now this person's tattoo is
That's right.
vintage. Okay, so
Yeah.
it's the exclusive one. So we're already got great takeaways for
Yep.
this podcast. If somebody has a tattoo of your logo and name on their body,
Yep.
consider the rebrand consequences.
That's
That's all.
right.
Yeah.
That's right. That's right.
DJ, tell
Or
us.
or offer free cover-ups.
So we've been talking a lot about Guardian as the organization, but let's backtrack a little bit and talk about you. You came in as like a digital marketing director, but what led you to that point to
Yeah.
be able to like come on to Guardian and help support them?
I'm in recovery. So this year will be, well, this year was 14 years.
Wow,
So
congratulations.
yeah, thank you. I was a product of good treatment myself.
Mhm.
So I came to South Florida, where Guardian is headquartered in 2012. Got clean, and did a couple different jobs here and there. Just in that time, like if you were living in Florida, you were probably working at a telemarketing place, like selling ADT or something. That was like really not exciting. So, normal recovery jobs. And then I found my way, um, luckily enough, because I had some telemarketing experience for like 5 months into working at a treatment center doing their admissions. And that I really loved. I was like, okay, this is something that like I enjoy. Um, I like the work we do. I like talking to people about recovery and treatment. And that really gave me like the first exposure to like how the treatment process works from the business side.
Mm.
In that first treatment center, which was like a startup, it was, founded and funded by some like private equity guys out of New York. The treatment center didn't last, but like I learned a lot. And I was always a techie guy. Like I love technology. I like just, I love anything techie. So like as I was doing admissions there, I was like, DJ, why don't you do our IT? Can you like reset the modem, and then can you like do all these IT things? And then like eventually I was also the IT guy. And then from there, it was like, what about websites? You ever built a website before? Because our website's not really working. And like, you know how to reset the modem. Maybe you can fix the website. And yeah, I just started learning on my own, just YouTube videos, and how to build a WordPress website, and how to do this and how to do that, how to make a Google Ads campaign. And that organization, I just started learning as much as I could about digital marketing, and I really, really loved it. I say this a lot, like I really like puzzles. Marketing is a lot of puzzles. Um, and yeah, I was thrown into the fire, like substance use disorder, addiction treatment marketing, especially in South Florida. Like it is,
Cutthroat, Thunderdome,
yeah, it is like the
Mad Max style.
the most competitive market. So I immediately was like thrown into the fire, which was good though, because like I learned digital marketing in probably one of the toughest industries that exists. So I learned like to be really, really strategic with every dollar that was spent, every decision that was made. Ultimately, from that organization, um, when I closed down, it was like my baby. But by the end, I was like, I had done the website, I had run all of our campaigns, I had built the call center flow, we had started building a CRM. Like I'd done all this stuff there. My heart was broken when it closed down. I actually did my own like, freelance, website stuff for a little bit. And I was kind of like opposed to going back to treatment because I was like, oh, I was so sad that like everything I
Mm.
built kind of like went away. Um, and kind of like I forget the mafia movie. It's like, just when I thought I was out, they pumped it back
They
in.
pull me back
Yeah.
in.
There was a treatment center in Florida that like, was doing really well. And like one of their like HR recruited people found me and they were like, just come talk to us, meet with us. And like the offer was good. So I worked there for a little bit. And there's a funny story. So this place that I was working at, it's like, probably like an hour and a half drive from my house. So which is like a decent commute. So an hour and a half there, hour and a half back. I was doing good. The place was doing great. And the guys from Guardian, through a friend, like reached out to me, and I was like, guys, like I'm kind of happy where I'm at. Like, it's kind of going smooth here. They're like, no, 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 just come meet with us, come talk to us. And I was like, all right, well, where are you guys at? And they sent me the address, and it was like from where I was living at the time, the condo, I could like see the building, like it was walkable. And I was like, oh man, I was like, all right, I'll come meet with you guys. So I went in there on a Saturday and I met Josh and Isaiah and a couple of the other team members there. And we clicked right away. I was like, these guys, they really believe in good treatment. Like their heart's in the right place. They're smart, they have good goals. I can, ride a scooter to work if I want to, which I
Yeah.
did do for a little bit. So I took the job at Guardian, and yeah, it was kind of history from there. It was just self-taught at the first treatment place, you know, doing my own thing, which was cool because I got to learn a bunch of different industries outside of treatment, learn some more stuff in some other areas, go back to another like national treatment provider, work there for a little bit, and then ultimately, take Guardian from really what was all of a BD play. Guardian really didn't have anything digital to, what it is now, where we're about 30%, 20 to 30% monthly admissions digital. We do about 11 to 1200 admissions a month, like brand new people who never been to Guardian before.
Mm.
So yeah, it's been a journey.
Yeah, wow. When you think back at starting with admissions and listening to people who are calling in, what do you think about people in marketing starting there and spending time listening to calls and spending time getting that voice of customer data? Do you feel like that was a kind of a foundational thing for you understanding the marketing side?
I think that my own recovery experience and connection to like people in recovery and understanding that side of it on that intimate level, which is not a requirement, but it definitely is a leg up, I think. I think working in admissions and hearing what people are asking, what they're looking for, what they're seeking, the questions they have, like I'm able to get in the headspace of someone seeking treatment or their family, because that is a piece that I think that I didn't have just as someone in recovery. Like, what's the family going through?
Mm,
Which half the time that's who's really making the treatment search and
yeah.
the treatment decision. So I think having those conversations with family helped me put myself in all of those headspaces when I'm building a marketing campaign or I'm building a page, and I'm understanding what needs to be prioritized in what order, what's most important, what needs to be said, what probably doesn't need to be front and center. That definitely helped. And like a lot of times the questions are different, like from a family or a client. The client may be like, well, what am I doing every day? Can I have my cell phone?
Can I smoke?
Can I smoke? Right. And the family's like, how much is this going to cost? Like, this is, my son's 10th try in treatment. Is this going to be the last one? Like, what's your outcomes like? What's the aftercare plan? Things that the client may not be thinking while they're in active addiction. So admissions, I think, definitely helps there 100%. Cause like I've had those conversations and I could answer those questions maybe on the website or on the landing page or on the marketing collateral even before someone calls in, and then give them that reassurance that like these people know what I'm going through, and gives them like that motivation to call.
Yeah, absolutely. When I first arrived in this industry, that was what I spent the most time doing was listening to calls. And I'm very glad that I did because it completely changed the way that I thought about it. I
Yep.
came from the fitness industry and there's a different set of problems that are connected with that. And when you hear the voices and it's not a user or not a patient, but it's a human on the other line, man, it really changes the way that you show up. And it also inspires you to figure out how to solve these kinds of puzzles when things come on, because you now have a name attached to a story and to like a user journey or a person's journey.
I think back when I was working admissions, this was a small treatment center. So like it was really where like if I was on the phone with someone and they were local, like I was getting in the tech van to like drive to this person's house and like do the intervention, and get that person in treatment. So like that experience I think really helped because like that there was no disconnect. Like I knew exactly
Mm.
what it took to like sit down with somebody, talk to them about treatment, get them on board and like get them in the front door. So extending that to like the first touch we had with them when they see us show up and again in marketing collateral online or wherever, like it matters. Yeah.
Yeah, and you talked about writing a call flow script for your admissions team. How do you do that if you haven't spent time
Right.
bringing people into treatment?
Yeah.
If you haven't spent time getting punched in the face over and over again, doing some sort of telemarketing and
Yeah.
understanding the complexities of talking to somebody over the phone who maybe doesn't want to talk to you or
Yeah.
is unsure about this. So I get it. I think that makes a lot of sense. When when you think about the industry right now and where we're at in this current time, what do you feel like is overrated and what do you feel like is underrated when it comes to um, treatment centers?
I've seen this a lot, especially on the smaller operator side. So someone um, entrepreneurial, usually product of treatment, in recovery themselves. I'm going to open a treatment center. Awesome, great. We need more treatment. As long as your heart's in the right place, you're going to build a great program. Well, like do it. Great. I think what they see is they try and follow the playbook of like a Guardian or another large facility that may have budgets to spend hundreds of thousands of dollars on Google Ads or on different marketing channels, recovery.com, whatever, and think that they're gonna fill their facility with like a single channel strategy.
Mm,
Um, I think Google is probably the biggest one you hear of. It's just like, oh yeah, we're gonna open up, we're gonna run, PPC campaign on Google Ads, and we're gonna fill this place up. Well, if that's your strategy, like I'm sorry for you because it's not gonna work long term. I think it's a good bridge if you don't have the alumni census for follow up and alumni readmissions when they have it. If you don't have the brand established locally where you're going to have people in the community reach out, if you don't have the business development relationships, they're going to start referring into you. Paid media strategy is a good bridge, but ultimately the goal should be to move away from that.
mm,
Like our strategy is always how do we reallocate budget to the cost per acquisition, the lowest cost per acquisition channels that from a business standpoint generate the highest lifetime value, right? So um, alumni referrals, hands down, always the best one, right?
mhm,
Like when an alumni refers to us, the cost per acquisition is essentially zero, just whatever we invest into our alumni program, which the return is amazing, right? It helps people, helps us. And those people stay in treatment. They stay because they've had you know, a friend to tell them how good their experience is, and that really
mm,
works. You're not gonna have that day one, and that's a reality. But I would say is like overrated is just thinking that Google Ads is gonna solve all your problems.
mm,
Um, Underrated, thinking about lifetime value as the true focus of your marketing
mm,
efforts, not just cost per acquisition. So I think the fallacy I used to think about a lot of was like, just where's the lowest CPA, right? So what's costing us the less to get someone in the door, and let's just focus on optimizing that, which is not wrong, um, but it's short sighted. So what we built at Guardian, um, which was through a really expensive Power BI build out, which the reality is with how quickly AI is moving, probably could be built out for pennies in the next couple months, just using, a really good LLM to set the stuff up for you. But understanding what admissions to which of your facilities from what channels are actually generating the highest lifetime value. If BD on paper looks great because they're getting a lot of referrals in, but maybe those are like two-way referral relationships with partners and they're coming to you just for a detox and then going back to them for res and PHP and IOP, that CPA may look great, but maybe because of I don't know, out of pockets deductibles, like your revenue from that client is probably really, really low. And even though the CPA looks great, it may not be what's going to really grow your organization revenue the way you want. Versus, you may look at like a Google Ads CPA or even recovery.com or any paid source, and maybe that CPA looks higher, but this is a client who's coming to you for the full continuum. And then they're now committed to you as alumni because they had a longer stay with you. And that's your starting of your alumni network to build either a readmission or referred by alumni. And maybe you have ancillary services like mental health support or other medical support. And now you have someone who you're like a more um multi-touch healthcare provider,
Mm,
not just like a single location, single instance of care provider. And even though the cost on the front end may look really, really high for cost per acquisition, the revenue is tenfold on the other side. So the benefit of that too is it's better for the client.
yeah.
Like the people who are coming into our care, they want to stay with us for the full continuum. Most of the people who are leaving addiction treatment are leaving with a mental health diagnosis and need medication management from a provider who understands addiction, who isn't going to prescribe them a narcotic or something like.
Mhm.
So, they want an alumni program because that's how they stay connected to the community and it helps us. So the good thing is we never find that our business goals and our client commitment need to be in conflict. In fact, more often than not, they're in concert. Um, and that was a really long way to answer that question. I'm realizing now, but I think that's it. Is like don't just look at the CPA as the end all be
Mhm.
all of what's driving it. It's really what your LTV looks like,
Mm.
and that should be how you're establishing your marketing strategy.
Yeah, so overrated, relying on one cost per acquisition strategy, probably Google,
Yep.
unless you're new to a market, you're starting out, you're trying to build up your alumni and your business development, and you don't have any credibility within the market yet. And then underrated is not focusing on customer LTV, lifetime value, and instead just thinking about CPA, which can be short sighted and also make you lose track of the other ways in which you can help a client the most, right? Whether it's outpatient services or a different level of care or whatever, right? Another track like mental health to substance use or something like that.
Hmm. Absolutely.
So, what advice you've been in this now for over a decade, right?
Hmm.
What advice did you get early on that actually turned out to be wrong when you think about look back at your career in treatment center
Hmm.
marketing? What ended up being wrong?
So, as a digital guy, which I still think of myself as a digital marketing guy.
Restarting that modem.
Yeah, exactly. That's it. All from unplugging that thing and plugging it back in. I think I was um biased into the stability of the digital channel away from business development. So I always in the beginning saw business development as the unstable channel. These
Mm,
are people. People have emotions and they're sometimes unstable and managing people is hard. It's the hardest thing I've ever done in my professional career. So I always saw digital as the stability, right? Like that was the bedrock is like if we just grow this and this thing like is firing at 100%, we don't have to worry about like the 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 people on the business development and the referral side because like that scared me because like I couldn't manage those with the same like scientific strategy that I can manage this one,
mhm,
right? Um, but that was really wrong, and it was wrong for a number of reasons. One, um, that stable digital channel is not stable. Right, that's something with the entrance of AI that has been a huge disruption to the digital channel, right? So like Guardian in October last year probably dipped 20-30% on organic admissions as Google went from uh, featured snippets over to AI overviews. Like the click-through rates for us just plummeted. Um, if someone's going to Google at all, maybe they're going to ChatGPT, maybe they're going to Claude, and like if you think someone's going to be having a conversation with Claude and they're going to ask a question about recovery and you're cited, they're going to click over to your site. I don't think that's going to work. I
mm,
think that's a short-sighted strategy. I think you have to really think how else are you going to get in front of people online. Anyway, I think that what ultimately happened was our business development folk was a stable channel. Like, as we're seeing all these disruptions and changes in digital and how search works and um, what AI is doing to digital marketing, we've doubled down on business development. 2 years ago, I think our business development count was maybe 10 to 15 reps. We're at like 35, I think, getting close to 40.
Mm,
I'm fine with that number going to 100, because I think what I found is if I build a good enough, um, first you have to have someone leading that team. We have someone whose organization, Ross Bacon, I'll give him a shout out. Best thing that ever happened to Guardian Recovery business development. Guy's amazing, handles the team like everything you would want from a sales and business development team leader. That's what he is. And what I found is like if you have that person, you can build a scalable, replicable, and like efficient strategy to get, you know, uh, a sales cycle and customer development and customer journey built out for your BD folks, developing referral sources. Like you can make that just as stable, if not more stable, as the digital channel that you used to think was
mm,
the bedrock. So I think that was it. Is my the fallacy in the beginning was like digital is like concrete and this is wishy-washy. Man, it's almost the opposite now. Digital, I'm like, well, I don't know what tomorrow's going to happen because I don't know what is going to happen to Google search. I don't know what's going to happen as the AI models. Are they going to enable ads? How's that ad going to work? How are they going to do the recommendation
yeah.
engine for local? All those unknowns, right? And this, I know, hey, this is a playbook. Like I know who our referral sources are. All I got to do is get really, really quality, good lead list to our BD folks. I had to give them a good system to develop those accounts. I have to give them a playbook to develop those relationships. And like without fail, a certain percentage of those are going to refer to Guardian. And like I can bank on that. So yeah, that's flip.
Yeah. So you overcame some of your own digital biases to be able to say, actually, let me rethink the stability of business development so that I'm more realistic about it, right? I think that's hard to do, especially when your skill set is aligned with one
Mm-hmm.
acquisition strategy to say, let me broaden my worldview. So hats off to you for that.
It was actually the other thing I would say too is it was actually fun and it's been fun because like been doing this for a decade, right? Like I know this. Like even though things change, like foundationally, it's a lot of the same. With BD, what we noticed was like not no one, but there's few operators in our space that run BD like a real B2B sales team that you would see in other industries,
Mm,
right? Like pharmaceuticals or SaaS or like these guys have like concrete like account development strategies and follow-ups and
mm,
automations and like really, really good CRM build outs. Like I haven't really seen a lot of people in our space have that. So like it was fun because I feel like it was a big undeveloped opportunity. And that's what we've been doing at Guardian is like, let's just build like the best B2B system. Like at any, like forget about in our industry, just in general, let's build like a world-class B2B system. And that's actually been fun because it's been something different,
mm.
so.
Yeah. Yeah. When I first got into treatment center marketing, I felt like I'd entered a time machine because so many things that have been tried and tested in other
Yeah.
industries were absent
Yeah.
within our, especially within content marketing, especially with a lot of stuff I was seeing in digital marketing. I was like, why don't you just do this? This is what other
Right.
organizations have been doing. And you found that too. You're
Yeah.
right. Like the pharmaceutical drug reps and stuff have an extensive BD thing and it works for them, but they also have really good processes.
Yeah.
When you think about the future of behavioral health, what do you think behavioral health leaders should be thinking more about for the future?
Um, I think what is really cool with the way technology is developing is we can get insights into business operations, client outcomes, like KPI reporting, like instantaneously. And it can be established now for pennies, like literal pennies. You can develop systems and um, you know, 10 years ago, we were looking at reports, a month in arrears, financial reports 3 months ago. Like I can tell you today, based on who's in our census, what our expected rev is going to be, what our cost is going to be, what our payer mix is, a certain location. Like I can't operate now without those systems. So I think the future is on an operational side. Like you need to, if you're not investing in a BD or a BI system build out where you have real time access to the data in a way that's easily manipulatable and like synced across your systems, then you're going to lag behind, right? If
Mm,
your EMR, your CRM, your rev cycle management system, um, your accounting system aren't, feeding into a data lake, or at least some system where they're queryable by an AI, that you can get real insights from, like you need to be doing that yesterday. The beauty is like when Guardian set down on the path to like build these systems a few years ago, it was very expensive, right? Hundreds of thousands of dollars of development hours, building a data lake, making identifiers across systems, pulling in data sources, you know, with MCP connectors and AI, like that's going to cost like nothing to
mm,
build. And some of it you can build now like very, very easily. So
mm.
I would say on the business operations side, like that's where it's going to be, is like you need to be able to have real time intelligence to keep up with the market. Um, on the client side, and I'll keep on, I guess, on the AI side, which is, we have started to layer on AI, clinical uh enhancements for our clinicians, not on yet like really choosing a patient treatment journey or clinical recommendations, but more on the clinician like optimization time piece.
Mm.
So ambient note taking, transcription, note for like note completion, all that kind of stuff. What that helps is, the clinicians didn't get into the business to like write 5 hours of notes to appease an insurer who just
Mhm,
wants to deny, right? Like they got this to help people. So if we
mhm,
can help ease the burden of the documentation piece and they can spend more time with the client, like that's going to be huge. Like if it's 30 minutes more a day or even 15 minutes more a day, they get to spend one-on-one with the patient as opposed to spending the time on notes, that's a real win. Like that might be another 3, 4 hours of time, in that person's treatment journey of one-on-one therapy that makes a real difference in their outcomes. Um, we have built a pretty cool system too, which I think this is the future of like predictive interventions when people leave treatment. So we we've taken like our EMR, our CRM, we do outcome studies, and we put those all into like basically a predictive AI to say like based on what someone reports on their outcome study, where they went to treatment, what they struggled with, what their treatment progress was like, who needs the most high touch follow up on the alumni side. And that's what uh, dictates the cadence for our human like alumni reps to call on people and
mm,
check on them and their families. So if someone's scoring a 10, maybe they were multiple treatment episode opiate user who, left AMA and, reported really, really negative results in the last 3 outcome studies, it's going to score them as a level 10. Like this person's probably headed to trouble. So
mhm,
we're calling them every day. We're calling their family. It may be someone who never went to treatment before, did their treatment, was a star person in treatments, doing aftercare, you know, hitting all their milestones. Maybe they're on a once every month cadence for follow up
mhm.
because we know they're stable. The win for us as an organization is we can help someone get back in the treatment. It's another revenue opportunity, which is great for us. But even better for the client, like if we can intervene before something terrible happens, like that's a great outcome, right?
Yeah, they're letting you know they're struggling without having to call.
Exactly.
And it kind of feeds into your first point. It's about having systems set up so that you can actually capture that data and
Yeah.
make good decisions with it. Because if you weren't tracking post treatment outcomes, then and you didn't have their in treatment outcomes, then you
There.
wouldn't know if they're struggling comparatively. So it makes a lot
Absolutely.
of sense.
Uh,
This has been an extremely helpful conversation, super dense. I think anybody would learn a lot from not just Guardian's story, but your own story. Thanks so much for joining me on Recovery Reach.
Thanks, Lynn. Appreciate it.